4D image even for the face. Number one, the 2D parameters should be optimized. I mean, you cannot get a lousy 2D image and then you convert it to 3D and then you are waiting to have a marvelous picture. So this is very important. The 3D image will depend on the good 2D image, and this is a fact. What is the region of interest box? The region of interest is the box that you put and then you make acquisition of the volume. So this box should be adjusted on the area of interest. So if you want to see the face, you don't put the area of interest on the whole baby. You don't put the area of interest on half of the face. So the area of interest, which is the ROI box, should be adjusted to take as a volume perfectly. And this volume you should see by your own eyes. The 2D is a perfect image in order to produce a perfect 3D image. After producing the 3D image, you have to select the proper rendering method. Even during acquisition, you are having it as a surface, as I showed you here. You can have it in the maximum or the mode or the X-ray mode, which if you want to see the bones, transparent maybe help a lot, but usually we are between the surface mode and the maximum or X-ray mode. If you want to see the bone, then the rendering mode will be in the surface mode. Of course, after acquisition, you may change, but it's better to have it before acquisition to start with you selecting the rendering mode, which is present in your control panel. This is very important. So, start the volume scan and adjust the volume image as I told you. The volume image parameter adjustment. After having the volume, there is a lot of adjustments: threshold, opacity, brightness, contrast, the color. Of course, you know that we don't have color in ultrasound. All this color added is just fake color. You can put whatever color you like, as I'm going to show some pictures. So this is all is production. I mean, you are doing manipulations as if you are executing a film. Then you accept the volume and store, and then after storing, you can manipulate a lot about this. So this is the region of interest. You put it on the face. And remember something which is very important. If you want to take a fetal face, I mean frontal view, like this one, you have to start with the sagittal, because the camera of the 3D is perpendicular to the 2D. So if you want to have frontal face of the baby, you have to start with the mid-sagittal in 2D. You are putting the box in a mid-sagittal. You don't start with the baby facing you. You go, baby is looking upwards like the mid-sagittal, and then this is the camera of the 3D. So it will make the acquisition as if it is in front of the baby. So what the resultant is through 3 images, starting with the sagittal, as we started here. Then this is the coronal or the frontal. This is the sagittal, this is the coronal, and this is the frontal. And the frontal one could be processed or could be done in front of the examiner as a 3D rendering volume. So this is very important. Once you get the image, you can adjust the threshold, because sometimes if your threshold is not adjusted, you'll find an image like this one. So when you have this one, you decrease the threshold in order to get this image. So this one and that one are the same. However, the threshold is not adjusted enough in order to get this image. So this is what I'm telling you.